Hello and welcome once again to The Art of Conversation, a radio show dedicated to a college course dedicated to the art of conversation. This program is brought to you by the Eileen G. Jones Honors College and the Department of Communication Studies, Media, and Journalism at Commonwealth University in Bloomsburg. I'm your host, Eric C. Miller, Professor of Communication Studies. Each semester, I teach a class available in your course catalog as Honors 211, The Art of Conversation, that focuses on the ancient art of dialectic. That is, the collaborative process by which knowledgeable peers pursue the truth through focused question and answer. After a few weeks of wading through the theory on these matters, our students spend about 10 weeks in practice holding twice-weekly 75-minute deep dives into topics and questions of their choosing. Our theme this semester is the state of the earth and the good life upon it, granting students considerable leeway in their choice of content. Every week, twice a week, we're talking about how to live better lives on this planet. My guests today are Aspen and Chloe, a pair of student moderators who this week asked our class to think a little bit about our reliance on modern medicine. Aspen, Chloe, welcome to the program.
Hi.
Hi.
So before we get going today, I'm interested in learning just a little bit about you. Maybe you can tell us about your majors, your interests, your goals in life, what it is that makes you interested in the question of modern versus holistic medicine.
I'm a speech path major with a minor in child life. Child life usually isn't very talked about, but it works with children in hospitals and basically like how to keep them better with everything that's going on. I have been in and out of hospitals my entire life, grew up with multiple chronic illnesses, so it's something that's very close to my heart. And I'm hoping to take my speech path in child life services and working with children in hospitals.
I'm Chloe, and I'm an environmental science major. I don't have any personal experiences with modern medicine topic, but I do have family, relatives who have had experience, and I think the topic's important to talk about.
In this class, we tend to build our conversations around a key question and try to, in the course of 75 minutes or so, solve the world's problems. Can you bring us up to speed on your research question? What is it that we're trying to figure out?
Our question is modern medicine a sustainable future to medicine?
Is modern medicine a sustainable future to medicine? Okay. Can you tell us a little bit, first of all, about your kind of key terms and assumptions here? I know when we talked about it in class, it seemed that there was an important distinction to be drawn between holistic medicine and modern medicine. What do these terms mean? What separates them from each other?
There's kind of a big, broad umbrella when it comes to holistic and modern medicine. So with modern medicine, you typically have your Western medicine and then your modern medicine. Modern medicine is typically your more experimental, your research-based medications and procedures. And Western medicine is stuff that's tried and true. That's like your Advil, your Tylenol, NyQuil, DayQuil, stuff you get over the counter regularly. And then under holistic medicine, there's a few different branches. So there's three primarily that we kind of discussed in class. One is holistic medicine, and that focuses primarily on using herbs and lifestyle changes to kind of help prevent disease and illness. There's homeopathic medicine, which tends to use some modern medicine inventions like Tylenol, antibiotics, stuff like that, in conjunction with more holistic paths, so like your herbs and stuff to keep up on getting ill. And then there's integrative medicine, which kind of combines both modern medicine and holistic medicine and is more tailored to the individual.
The other distinction that you raise here that I think is interesting and maybe a little bit confusing is between, you're using the term modern and the term Western to refer to slightly different things. And to me, the natural opposition to those terms would be something like ancient and Eastern. And I'm wondering if it's as simple as that. Does the holistic medical tradition come to us from the global East and the modern tradition come to us from the global West? Is it that simple, or is there more to it?
Western medicine focuses on a lot of medicine used in specifically the US, the UK, and Asia, all those other countries. Their medicine varies greatly from what we use in the US. So modern medicine kind of overbranches all of that. It's kind of global, whereas Western medicine is more focused in the US.
One of the reasons I ask is because when we were talking about this in class and we were using terms like Western medicine, I was thinking of the alternative being things like, Eastern sort of herbs and spices or acupuncture, other sorts of medical practices that come out of the East. And someone in our class mentioned that growing up in like kind of a conservative Mennonite family, that she was treated with all sorts of like homespun remedies and traditional. And I thought that was interesting because what she was describing was not what I think of as modern medicine, but it was also distinctly Western. It was just traditional instead of modern. I don't think we need to get too bogged down in the definitional question here, but I do think it's worth noting that when we talk about these two different approaches to medicine, there's just a whole bunch of qualifying adjectives that I think might make the situation more confusing than clear. Do you know what I mean? Is there a way to kind of cut through these?
Not really, because a lot of people are big advocates for whatever term they prefer. So you have a lot of doctors who be like, no, I'm strictly a Western medicine practitioner. And then you have other doctors who rave about like, oh, I'm a modern medicine doctor. I use all of these wonderful new technologies.
Okay, well, let me ask you this then. For our purposes today, is it useful, instead of talking about holistic, homeopathic, and Eastern versus modern or Western, if we talked about it in terms of modern versus traditional? Is that useful, or is that a poor use of terms?
I think it's a good use of terms. When I was doing more of my research, those are the terms that I mainly focused on. But then again, after we talked about it, I was like, maybe I should take a deeper dive on the total definitions of them. But traditional versus modern is mainly what I focused on, at least.
Okay, then I want to move on to another layer of definitional questions here, because this is something that I was thinking about as well. When people say that they don't trust modern medicine, they like to use traditional methods and remedies for their illnesses, as a modern person, or at least that's how I think of myself, I guess, in my own mind, there's some skepticism that arises in the back of my brain, because I want to say, well, look, we've got all these medicines now that have been tested in labs and proven, so maybe we should use them and allow them to make us well and happy. And one issue that arose, I think, in our conversation in class is that there are some things, some illnesses or injuries or conditions that require modern medicine because the traditional forms can't treat them. But that in general, a more traditional approach to medicine and self-care is better as a means of preventative medicine. And so I want to kind of follow up on that question with you today. Is traditional medicine better, healthier as a preventative form, whereas modern is sometimes necessary to treat more serious conditions?
Yeah, I would totally agree with that. I think that traditional medicines work more effectively if they're used as preventative methods. However, I think even if you do use the modern medicine forms, you can still use the integrative method and get better with both rather than just focusing on the one.
I mean, she summed it up pretty well. That's kind of what integrative medicine focuses on, is using traditional medicine as a preventative, and then modern medicine when you kind of need that extra boost.
Well, I think, the examples that we came up in class were things like if you have an infection. When I had strep throat last year, and my first inclination was not to see if there was anything in the herb cabinet that could help me with that. I went straight to urgent care and I asked them to give me an antibiotic, to try and correct that. This maybe is a useful example because, as I recall, you had suggested that there are also traditional treatments for things like infections. Can you help me understand, when's the right time to go traditional and when's the right time to opt for a modern remedy?
There's actually a lot of research into kind of antibiotics and antibiotic resistance right now, because as a whole we rely on antibiotics a lot for things like strep throat, or we use them for surgeries and stuff to prevent infection. And that's kind of one of the limitations that traditional medicine hits, is that oftentimes it's better as a preventative, whereas when an acute issue pops up, like strep throat, or you have a really bad cut on your leg, or something that's going to get worse before it can possibly get better, that's where modern medicine and all kind of steps in. Because modern medicine is a lot better at treating those quick to fix issues, whereas traditional medicine kind of takes time to implement into your lifestyle as well as to experience the benefits.
Let me ask this then, just as kind of an aside. This is a semi-serious question. I have noticed that there is kind of a gendered component to this, or I think there is, in that traditional medicines seem to be more attractive and more interesting to women than to men. And the reason I say that is because my wife is very interested in these things. And when she gets together with her sisters, they're always talking about what herbal supplement you need to take to correct whatever health concern. And I'm just kind of sitting there in the back of the room, rolling my eyes, thinking, well, just go to the doctor. And I think I'm not saying it's true in every case, but there is kind of a tendency there. And I'm wondering if you've thought at all about that. Like, why do you think that might be?
Medicines are not trialed on women. They are mainly trialed on white, Caucasian, usually mid-adult aged males. So there's not a lot of evidence that what we use to treat males is actually as effective or even beneficial for females. And that kind of creates a big rift in medicine where it might be a little bit more risky or suspicious to use modern medicine as a female, because you're not exactly sure how it's going to affect you.
So I might be inclined to trust it more because it's specifically geared to work on somebody like me.
Exactly.
Is what you're saying. Okay. Well, that makes sense. And I wanted to use that as kind of a segue to talk a little bit about trust issues with modern medicine, because I think this is a big issue right now. It's not just about whether or not you use traditional or modern forms. There's a lot of skepticism since the COVID crisis about vaccines. I mean, there was questions about that before. A lot of people on the internet spreading these ideas, these claims that vaccines are associated with autism and things like that. And I guess for myself, I am prone to write off most of that concern as internet conspiracy theorizing. But at the same time, I am somewhat open to skepticism of modern medicine, in part because it has a troublesome history in some regards. And you don't have to dig that deeply to find examples of people who were ill-served or even actively abused and exploited by our medical system. And more than that, I am prone maybe to be somewhat suspicious of it simply because it is a private industry that is driven by a profit motive instead of by pursuit of the good welfare of all humans. You know what I mean? Have you thought at all about the fact that our healthcare system is privatized versus like a public health system and what that might do to trust levels among patients?
I'm enrolled in a course right now all about kind of health communication and that side of the medical industry, and it is looked at a lot, the fact that oftentimes doctors are not operating solely based on their education. They're also operating on policies and conditions that are placed on them by higher ups, especially if you go even hospital to hospital. I just had this happen with me recently. I'm trying to get my wisdom teeth removed. And if I go to one hospital or a different practice, they use completely different codes to bill my insurance even for these things. So there's a lot of also not good fluidity in what we can bill for or what we deem as necessary. Because it's not always doctors saying, okay, I actually think you need these tests. Oftentimes there's policies that are like, okay, well, you need to rule out this policy and this thing before you can go on to the actual thing that you want to test for.
There's just so much money tied up in it, and the incentives to me are concerning because it's about how can we maximize our revenue streams, not necessarily what do we have to do to make sure everybody is cared for and made healthy. And I think that's like a legitimate concern.
I know we talked about it briefly in class, how like things now are designed to break sooner, so you need to replace them, and that kind of thing in modern medicine has unfortunately been implemented too. A lot of the medicines that we're given, Advil, Tylenol, your antibiotics, they're meant to be quick fixes for whatever ailment you're suffering from, and oftentimes when they're used over and over and over again, they become less effective. And then we have to invent new modern medicine solutions to fix the ones that we're already breaking.
Yeah, the term for that we've used in class is planned obsolescence, which is the idea that people who manufacture products for sale don't have an incentive to make them durable and lasting, because then people don't come back and buy more of them later. And so a lot of industries have implemented, as a matter of policy, building things to last a certain amount of time and then fail. I don't know if that is cleanly analogous to the medical field. I hope that it's not. But again, I think the fact that our private healthcare system is driven by a constant incentive surrounding growth and profit can at least leave some reasonable doubt in patients' minds when they're being prescribed medicines, or when doctors are ordering tests that they have to undergo, and when you have to clear a series of hurdles before your health insurance plan will cover the next thing. It's just, as a patient, I think you're liable to feel kind of like a lab rat. This isn't really about making you well. It's about checking a bunch of boxes and making sure the money is right before your health becomes part of the equation. And I'm not trying to malign the medical field or medical professionals or doctors. I certainly am more inclined to go with modern medicine than with other types, as I said. But I think there's a room for that discussion. In my classes a lot, when these issues come up, somebody always suggests that we should go with a Medicare for all plan, or like a universal health care system. Do you think that would address the concern you're raising here? Or would it still just be more modern medicine that's more harm than good?
One of our videos that we made the class watch for the discussion, they talked about this question, and most of the doctors that were in the video said that they don't think that would solve the issue at all. And I think that that's mainly in part because it is profit driven for the most part. At least that's what I could see. Like, you can go to the hospital and there's going to be so many random things on your bill that they wouldn't really tell you what it actually is for. So I think in that case, it wouldn't necessarily be better for all, but it would help more people get to access to the healthcare they need. But some cases it would still be the same and not much better.
I know one of the drawbacks that's talked about for like a Medicare for all program is that it will increase your time to get into a doctor. So I know that a Medicare for all is implemented over in some European countries. And while it's great they don't have to worry about bills for their health care, they're also sometimes waiting 3-6 months to get into a doctor for an issue that by the time that they get into the doctor, they might not even be dealing with anymore. And then another drawback that's often discussed is the kind of knowledge component behind medicine, where doctors are placed on like a higher idolized pedestal because they hold all this knowledge that even if you have access to like your lab results or you have your x-rays that you can look at, there's not really anything you can do with those to kind of contest and say, hey, why are we doing all of these tests? Because most times you don't even understand what they mean.
I know we have a health communication minor here in our department, in part because that concern has been raised so frequently in the past, or there have been so many patients who have come away from interactions with doctors or with hospitals and felt really unsatisfied with the interaction, or they felt they were condescended to, or they felt that bad news was broken to them in an insensitive way. Or, there's any number of different ways in which communication becomes a really important skill for medical professionals to have. Let me ask you this, but we're going to get into some specifics here in the second half of our program. But given the generalized suspicion of modern medicine that is so pervasive right now for a number of reasons, and given that you are interested in traditional forms of medicine and I think prone to adopt them before going with modern medicine. How do you assess the popular suspicion about the medical world today? I mean, would you say that it is justified and you are modern medicine skeptical, or is that a mischaracterization of your position on the matter?
Personally, as you said before, if I have something wrong with me, my immediate thing is go to the doctor or ask my mom and she'll tell me to go to the doctor. But I would like to, if I had more access to it and more knowledge on the topic, I would like to get into the more traditional medicine and just have like a healthier lifestyle so I wouldn't have to heavily rely on modern medicine.
See, I was raised in a completely different background. My mom is considered I think TikTok uses the phrase like a crunchy mom, but we grew up on using essential oils. We drank, tea when we got sick. We used more traditional alternatives because we had so much going on with us that it's a lot easier to rely on something that the earth is already giving you than something that has been engineered 100 times over to get this one very specific component out that has probably been altered within the process anyways. So I default a little bit more on the skeptical side, but due to my position in the medical world, I've kind of been forced to use both traditional and modern medicine and kind of learn how to blend those together to get like the best outlook for me personally.
No, that makes sense to me, and I don't think it has to be like a binary. You're either with modern medicine or against it. I know in my house it's all yoga and organic foods. In fact, I have a bottle of essential oil here on my desk. This is Stress Away. It's supposed to make you feel more relaxed, and that's fine with me. I think that for myself and for a lot of people, if there are ways to maintain your basic wellness without putting a ton of extra chemical compounds into your body, then that's an attractive thing. And maybe that makes you crunchy, but maybe not. Maybe it's just a more moderate, slightly more cautious way of living. And I don't think it necessarily makes you like a medicine denialist or something. It's just to make that much as clear as possible. If you are just joining us today, my guests are Aspen and Chloe, and we are speaking about the relationship between traditional and modern medicine. We'll be back after these words. Welcome back to the Art of Conversation Radio. I'm here today with Aspen and Chloe, and we're talking traditional versus modern medicine. At the very beginning of our episode, we spoke with our guests briefly about their personal interest in the matter, and both mentioned having some personal experience with this issue, with using traditional medicine as opposed to modern forms. And I think that might be a helpful place to pick up in the second half so that we move from the abstraction and definitional stuff into pragmatic personal experience. And so let's start there, maybe with Aspen. Can you tell us a little bit more about your personal experience with illness and with medicine and how that prompted you to be interested in this material?
Yeah, so I have grown up with, officially my diagnosis list is at 23 today, genetic conditions. So I have a younger sister. She has all the same conditions as me. My mom has a lot of similar conditions. So I have been in and out of the hospital since before I could walk. And quite frankly, without modern medicine, I likely wouldn't be in the position that I'm at today. And I'm very grateful to be able to be here and be discussing this because of modern medicine. But one of the drawbacks that I started to experience as I had been on modern medicine longer and longer was that I was having interactions between different drugs. And I was taking, at one point, I called it my little rainbow because I literally had a pill of every single color that I had to take every morning. And I've since, over the past 3-4 years, I've started kind of integrating more traditional medicine into my lifestyle, have been able to decrease my little rainbow to just a small few medications every day. And I've found that these have the traditional the more traditional medicines have been more effective in conditions that I've been dealing with since birth than conditions that have occurred more recently. And one of those is like a heart condition that I have. And I've been able to treat it with traditional medicine and actually reduce 2-3 medications that I was taking for it before that were having interactions with other drugs that I was taking. So that's kind of my standpoint on it. And I've seen a lot of it being in a medical major. I'm a speech path major, as we said, and seeing how things like cerebral palsy or strokes are treated. Some of the medications that they give for those actually can make conditions worse if they're not given at the right timing, if they're not given the correct dose. So I've kind of seen some of the effects of that as well within my major.
Can you tell us a little bit about you said that you're taking a natural medicine for a heart condition. And to me, a heart condition sounds very serious.
Yes.
And so that is the sort of thing where I think my default would be like, what's the pill that the hospital wants me to take,
Yeah.
But if you have found a traditional means that reaches the same end, I'd be curious to hear a little more about what that is and how it works.
Yeah, so I have a condition called POTS, stands for postural orthostatic tachycardia syndrome, which basically means my heart doesn't regulate my pulse and my blood pressure correctly when I change positions. So when I first got diagnosed, I could be as simply as standing up and sitting on the couch and I would faint. Or I would be doing gym class, trying to run for a little bit. I would be fainting, getting really dizzy. So I was originally prescribed a medication that would purposefully elevate my heart rate before I engaged in physical activity so that I wouldn't be having these fainting episodes. The way the condition works is it lowers it instead of raising it, so it's kind of balancing that out for me. And I began taking that, and over time it kind of became a little inconvenient because I would have to schedule it within my day. So if I knew I had gym class, I would have to go all the way to the nurse's office, take my medication a half hour before, wait 10 minutes, make sure it doesn't have any adverse reactions, then go to gym class. Then I'd have to be monitored after gym class. And it not only was inconvenient to me, it was inconvenient to people around me, my friends. They all want to change in the locker room together. You all want to go get, drinks at the water fountain after gym. So I spoke with my doctor about it and kind of did some research into the condition on my own and found that it is also often caused by an electrolyte imbalance. So I spoke with my doctor and I began taking a lot of extra electrolytes in my diet, so things like Pedialyte, Propel, Gatorade, stuff like that, as well as I started physical therapy to try to recondition my heart. And after about a year or two, I ended up not needing the medication, and I just can kind of continue that physical therapy and using electrolytes and kind of altering my diet, and now not having to use a medicine that was kind of inconvenient and possibly causing adverse effects to me.
So would you say that things like exercise and diet count as traditional medicines?
Yes, traditional medicine focuses really on the preventative and using natural alternatives to kind of prevent false outcomes. So for me, using the electrolytes and adding that into my diet, almost like adding a medication, helped to balance out what was already happening in my body without throwing in a chemical that would kind of force my body to behave in a specific way.
See, I think framing it that way makes it a lot more accessible to a lot of people because eating well and getting exercise are just basic preventative measures that everyone or most people take, right? And they don't think of themselves as hippies necessarily for doing so. I guess my skepticism about the whole thing arises when, if someone were to say like, oh, I've got, heart disease or I have cancer, so I'm going to start taking more like fish oil or like turmeric or something. You know what I mean? To hear it framed in that way makes it very different.
Yeah, I don't have any much personal experience within the modern medicine field like Aspen does, but one of my relatives, my grandfather, he's passed away a few years ago from heart attacks, and he was put on a lot of medications from it, and it ended up having him having really bad mental health issues, other health issues down the line, and obviously he passed away, so I personally think if he was given more information about other approaches he could be taking rather than just all these pills that led to worse outcomes down the road, it definitely would have been so much more beneficial.
I think that's one of the things too that draws people to homeopathic medication or traditional medication is that you have a sense of control over what's happening. So I know for me especially, I was being told I have to do this at a certain time, monitor this. Now I have to watch what I'm doing in this area, can't do these activities. Whereas if I took the more traditional route, I had a lot more control over my outcomes, which is often lacking in your modern medicine field.
You guys are giving me like flashbacks. About 20 years ago, I had a surgery that resulted in my getting an internal infection. I got infected because I was taking too many antibiotics, and then I'd take other antibiotics to fight the infection, and then I'd take like something else, and I ended up breaking out just in hives all over my entire body. And this is like a process that played out over like a week or a week and a half, and by the end of it, I was just so exhausted. Like, I am being destroyed by the process. You know, it began because I needed to have this procedure, and then it played up these steps. And then it was just a question of, okay, what new medication can we give him that will offset the negative effects of the others, and will that cause new effects as well, you know? And I wouldn't wish that experience on anybody because it was very miserable. But because it happened to me when I was young and otherwise pretty healthy, I bounced back and had a happy, healthy life after that. But I remember thinking, like, I would be so despairing right now if I was older and if I was less healthy to begin with, and if I didn't see my way out of this fog, this tunnel of medicines and side effects and reactions. And so I think the types of experiences you're describing are certainly foundational to a little bit of modern medicine skepticism. How central would you say negative side effects are to your position on this issue? And we could even throw in there, like, as an example of a negative side effect, addiction. Some of these pills that people end up taking are quite addictive. Is that central to your interest in traditional meds?
I think so. We talked about a lot, like, overprescription and how that's a big downfall to modern medicine, which would obviously lead to a lot of addiction because you're getting medicine that you don't necessarily need if you're just being overprescribed, which goes back to you could be taking these alternative methods that you wouldn't necessarily need. And then the overprescription, yeah, if they have side effects, you're going to get a multitude of them if you just continue to take more and more.
And I think one of the things that isn't talked about is the fact that you can become addicted to traditional medicine alternatives as well. I know a popular treatment for things like asthma or like deviated septum, stuff with your sinuses, is often like an inhaled essential oil or inhaled herbs or salt, stuff like that. And there have been cases, especially in a lot of Asian countries, where people will use these so much that then their body relies on them and they can't go without using the inhaled substance. So I think there's a drawback to all types of medication in which if it's not used in a proper and ethical way, it can cause harm anywhere.
Well, sure. I mean, there's lots of natural substances that have addictive properties. Sugar, for example, is a problematic one in our national diet. And yet, it's not on the same level maybe as something like opioids. And this is something that came up in our discussion as well, that back in the 1990s, the turn of the century, there was kind of a crisis in the medical field in that doctors weren't adequately treating chronic pain. And so you have all these people who are suffering from pain that is going undertreated. And as a corrective to that, medical professionals started looking around for painkillers that they could administer that were more effective, higher potency, and ended up finding their way to oxycodone, I don't ever know if I'm pronouncing it right, and prescribing it at a very rapid clip. And so lots and lots of people start taking these meds to try and address their pain problems. And then, fast forward a decade or two, and here we are. There's like what we now call the opioids crisis of people who get addicted to these pills, and then their prescription runs out, and then they turn to other opioids to try and get their or satisfy this addictive craving that they have: heroin, fentanyl, overdoses, death. I mean, when you look at that whole saga, what's the moral of the story to you? I mean, does that factor into your skepticism of modern medicine?
I definitely think so. I feel like something with that, there should have been so much more research done in the first place so it didn't get to that point. And I looked into it a little bit last night, and because I didn't know too much about it, but it said like it was heavily overprescribed, it was aggressively marketed, so that just like led to a chain of events, and it's still happening today. People are just getting so addicted. I think that just goes back to our main thing, like overprescription is so heavily done and it shouldn't be.
I think it also plays back into the knowledge factor where people didn't realize how damaging this drug that they're taking could possibly be, and doctors weren't knowledgeable on what it could do because they were focused on quick fix, get it out, get the problem solved. We'll worry about what happens later. And then we'll create another quick fix to solve that problem. That might cause some more problems later on. And it's kind of this snowball effect that again leads back into the profit, where it keeps bringing people back because these medications, these drugs aren't being thoroughly investigated in the long term, and they're also not being investigated on a diverse population. A lot of when opioids were originally created, research and effectiveness was tested on white, middle-aged Caucasian males. We don't know how they affect females, how they might affect African American individuals, those with more Asian descent. There can be completely different effectiveness for those people, but we'd never know because they didn't look into it.
And I think it's just like scary because you're going to the doctor to get help. No one in the start of the opioid crisis like thought that this would be the outcome. You're not going there thinking that you're going to get addicted to a drug. You're thinking that they're going to help you. And then it had this total snowball effect.
Certainly, I would say the opioid example humanizes doctors for me a little bit, because I am prone to this sort of professionalism or credentialism. I am willing to look at them as like modern shamans who have the answers, and can get you healthy. And when people cast doubt on them or suggest, it's just a business and they don't, I am maybe like instinctively defensive of them. But there are examples that you can draw to that should at least urge a little bit of caution. And I think it's fine for people to be a little bit hesitant about these things. And I know a lot of people are, especially when you go into a hospital and you have this class of professionals who know what's best for you or seem to, suggest that they do. And if you have questions, they might not be answered adequately, or they might be dismissed. Or if you're skeptical of the treatments, you might be looked at as kind of a quack. I think there must be some kind of a healthy medium here where some of these things are concerned. With the opioid example, though, I want to ask you about an alternative medicine that I hear about a lot because I teach public speaking. And in the past decade, I have heard so many speeches by students advocating for the legalization of marijuana, both medicinally and recreationally. And I happen to think that marijuana should be legalized too. I find a lot of their arguments pretty persuasive, but they have a tendency to pitch it as some kind of a panacea to all of our problems. And oftentimes, in one feature of those speeches is that they'll say, one of the reasons that marijuana has been illegal for so long is that it's such an effective painkiller. And Big Pharma doesn't want people to have access to it because they would rather sell you something more expensive and maybe more addictive, maybe more harmful. And it quickly acquires this sort of conspiratorial sort of veneer. I wonder if you've given that any thought, and maybe are there other, it doesn't have to be marijuana necessarily, but other natural forms of pain relief that you would endorse over and against some of these prescription drugs?
I know specifically with the marijuana legalization kind of debate, one of the big drawbacks of using marijuana for pain treatment that most people don't talk about is the way marijuana metabolizes in your system is it slowly gets stored in your liver. So after time, you have to do a detox of the system in order to kind of reset your body. So there is kind of a limit to how much marijuana you can use to kind of treat pain or mental health disorders or chronic illnesses, which can be a drawback because if this is what you're using as your medication, most detoxes you have to do 2 weeks. So going 2 weeks without any pain medication or treatment for an issue is oftentimes not feasible at all. So rather than relying on it solely, I stand in the position that it should be used in addition to treatments. I know it has been proven to be very effective for people with seizures. I have a friend who was able to get off of multiple medications for seizures by using medical marijuana. And I think one of the other good things about marijuana is that there are 2 different types of oils that are derived from the plant. One is called THC, and that's the part of the plant that gets you the high, that gets you that feeling. And there's also this other component called CBD, which is more of the relaxing component, and that's often what's used in pain treatment. That does not have a cap on where you'll stop feeling the effects, whereas THC does. So I know that a lot of people have issues where if they're not fully educated, they might just think, oh, you're smoking it to get high. You don't want to have to deal with things. Whereas with the CBD, you don't even have to get high at all. You can apply it in a balm. You can do it as like an oil underneath your tongue. You can take it in a capsule form. And that is proven to be effective in use with other medications or other treatments.
Yeah, I think that all that's really important to consider. I haven't really dug too deep on the medical marijuana type thing, but the students in your public speaking classes would say about how the healthcare system doesn't necessarily want them to incorporate it because they could potentially lose money from it. I think that goes back to the distrust, because if it could potentially be helping patients, they should be doing it. So I think it's just a tricky subject.
Honestly, I think if it is true that Big Pharma doesn't want to compete with medical marijuana, the most likely outcome is that they eventually just buy up all the grows and turn it into a pill that they then sell for an inflated price. There's been a lot of discussion about that too, that people who used to grow and sell marijuana illegally are by and large in jail now, and a whole new class of venture capitalists have filled that void to monetize it and to start selling it legally in a white collar sort of a fashion. And so I don't see why Big Pharma wouldn't eventually corner the market on CBD oils or whatever form it ends up taking. One term I want to revisit, though, is since you've talked in response to this question about mixing traditional remedies and modern remedies, that you referred to as integrative medicine. Seems to me like a logical middle ground between being fully crunchy and being fully quote-unquote modern. And so I'm wondering if you could tell us a little bit about what that looks like in practice. Like, to be somebody who subscribes to integrative medicine, what does that mean? What does it look like day to day?
I think that, as we've been talking about, it would mainly just be having a healthy lifestyle, taking the supplements that you think you need. But you have to be careful what you do pair together, because you can't be doing, I guess you could say, too much at one time. I don't know the extent to that, but you do have to kind of consider, like, you shouldn't be taking all these medications on top of the traditional medicines too. But integrative would be like the healthy lifestyle, the supplements that you need, on top of the small amounts of medication that you technically, like, the minimum that you need.
And that sums up what integrative medicine is as a whole, really. It's using more traditional avenues to kind of maintain that healthy state than using modern medicine where it might need that extra pickup. And you brought up how, like, you can use too many items at once, and I think that's one of the main reasons that people draw back from holistic medicine and traditional medicine, is because it's not used in a modern medicine practice. There's very little research about it. So when people are trying to take this aspect of control and then it interacts badly with what they're already taking, the finger is immediately pointed at the traditional medicine. It's ineffective. It's not researched. You guys don't know what you're doing. Take another pill. And that's kind of the big issue between traditional and modern medicine, is the lack of research and lack of knowledge.
And so as I look at this question today, near the end of 2024, I see on the one hand a private healthcare edifice that is huge and super wealthy and powerful and seems to really dwarf the traditional alternative. But on the other hand, I also see lots and lots of people who are at least curious about ways that they can treat their bodies and their health without resorting to prescriptions and pills and injections and all that stuff. And that's maybe related to this broader skepticism about the medical profession, about vaccinations and things like that. It's not a polarity, it's a spectrum, and you fall on it at some point. And so as you look at this, do you think that a more traditional medicine future is possible, or do you think it is bound to be relegated to the margins of American life as people continue to go first and last to the doctor and to the pharmacy?
I think it could definitely be possible. However, as Aspen was saying, we do need more research on it. And I think if there was more research and funding, then more people would be on board. But as of now, if we're continuing how we are, and there's not too much research or the funding, which is very important, I don't think a lot of people would be on board with it just because they want that quick fix. They want to get better as soon as possible, and they're not really considering the preventative methods that they could be doing. They just want a quick fix.
We live in a culture, especially in the US, where we're looking for the next bigger, better thing. It's idolized to be, productive. You're always, 24/7. You're the person that's working on the project 5 a.m. and you're the last one logging off at 8 o'clock at the end of the workday. And so modern medicine kind of fits right into that culture where it gives us the best fix, the quote-unquote best price for whatever it is that we need. I mean, there's millions of different medications for millions of different issues. And that's where traditional medicine kind of gets cut off, is where you have to put in more of a slower pace in order to get those benefits.
I think that's a good point to end on, and I think it's broadly applicable to lots of elements of American life. I mean, as you guys know, we talk a lot about climate change in this class, and it's one more instance in which I think an ounce of preventative medicine along the way would have been really, really beneficial. And now we're increasingly at a moment where we're just looking for a miracle cure, a quick fix when really we had decisions that should have been made differently along the way. But perhaps I digress. Anyway, thank you very much, Aspen and Chloe, for being on the show today.
Thank you for having us.
As always, I am your host, Eric C. Miller, and this has been The Art of Conversation Radio, brought to you by the Eileen G. Jones Honors College and the Department of Communication Studies, Media, and Journalism at Commonwealth University, Bloomsburg. Thank you for listening. Have a great evening, and we'll see you next time.